I'm approaching the Furaha Centre in Meru, Nairobi, and those are there is some very exceptional children here that are suffering from cerebral palsy and a few of autism. This is a structure of a dear friend that she's actually devoting her life into this. She has rented this house, which she's making it to work as a mini rehabilitation center. And as I come here, I had the children accommodated for you. Say hi to the founder.
Hi,
Introduce yourself.
my name is Jadlyn.
Okay, name is Jadlyn, and here, Jadlyn, this is the house that she has rented. And this is the children. Those are some of the children. This is a new establishment. It's been open a couple of months, and she's actually taking in children with cerebral palsy. And as you can see here, we have this little girl here that was not walking as she had the stiff bones. And can you explain? What's? She's doing much better now, eh?
Yeah,
She was not walking, I believe.
Yeah, she was not walking. She came with tight legs and arms.
Okay.
Now she walks, and she has a sister. She has a brother here.
Okay.
She's Jibo, and she's 10 years old.
She's 10 years old, and she has cerebral
She
palsy.
has cerebral palsy.
Okay.
Yeah.
Hello.
Say hello. Hello.
Say hello.
Hello. Say hello. Hello.
Yes. Look at her legs.
Yeah.
Okay. And then we have this little cutie one. He's a boy.
Yes, he's horseman.
Oldsman.
Yes, he's 6 years old. He is the brother to Jibo.
I need to see you in the video.
He is the brother to Jibo.
Okay.
Yes, he has cerebral palsy and he has tremors. As you can see, he's shaking.
He's shaking, yeah.
It doesn't mean that he feels cold. He has tremors and the hands are also very stiff. Now
Okay.
we're trying to work on one of the legs so that he can see if he can stand
Okay.
now.
Are they taking any medicine, these children, or
No, apparently no.
no? Do they need medicine?
Yes, like if they have conversions, but apparently they don't have conversions.
Okay. So, and then here we have
Here we have Mr. Alvin.
Alvin. Hello. Hello. Say hello.
Say hello. Hello. Hello.
He's got also cerebral palsy.
Yes,
So everybody in a form, they react in a little bit different than each other.
Yes,
He's a little bit more, seems a little bit more stable,
and
but
very intelligent. He's
very smart. Yes,
intelligent,
I'm sure. Yes,
Yes.
he's a beautiful
And
boy.
it's because of meningitis that he got cerebral palsy. Otherwise, he was born normal.
He was born normal and he got meningitis
Yes.
and he developed a cerebral palsy.
Yeah.
Fun. Okay, I understand. And then here we have one of the nurse taking care of.
Taking care of Jacinta.
Jacinta. Okay, this is Jacinta. Cerebral palsy as well.
Yes.
Okay, so as you
10
can
years
see,
old.
the form is a bit different than the boy that we just saw over here. He seems a little bit more normal, but she was born with the cerebral palsy,
Yes.
apparently. Okay. Say hello. Hello, Jacinta.
Hello.
See the hands? They need to be completely stretched, the bones.
Yeah.
They need physical therapy every day. And they are in excruciating pain when they do it. Let's move to the next child here. This one is?
Candy.
Ah,
He's
this
Gradual Candy.
Candy.
Yes.
It's a beautiful name.
Yeah.
Okay.
Candy in English, if you translate it from our local language, is loved one.
Loved one.
Loved.
Oh, the loved one.
Yes.
Okay.
Yes.
Look at that.
She fears light a little bit, as you can see the eyes. She's not opening very well.
Okay, she's swollen eyes.
Yes.
The eyelids are swollen. Why?
Because she's always closing the eyes because of the light. Or
So she's closing the light. So she's probably needs some special glasses. And I really urge you to really think about making a very small donation for the Furaha Centre, even if it's $5 to $10, and you'll be able to PayPal them. I will be giving you the PayPal, and this is it's going to make a very big change to those children. And we're talking $10. I mean $5. I mean it's really not a big deal, for us. This is the one I was doing the physical therapy before, and she was crying, screaming like I never seen before. What's your name?
Michelle.
Michelle. Hello, Michelle. Hi. Hello. She's also has cerebral palsy. She needs heavy physical therapy every day, and you can see her bones.
And the legs.
The legs.
Shorter,
See?
one is longer.
One is shorter, one is longer.
Kind of this side is more affected. You see, even the hand is.
So the left side is much more affected than the right side. I mean, she's such a brave girl. And then we have here
Yeah, we have
this little
Lucky.
boy, Lucky.
Yes, Lucky is 12 years old.
And is he cerebral palsy or is autistic?
He's autistic. He has like combination of all of them.
Okay.
And he also has he has multiple challenges because he also has partial.
Okay.
Yes, one eye cannot see well.
And one eye cannot see well.
Yes,
He's blind too.
he is partially blind, as you can see. This eye.
Yeah, his left eye is actually
Yes.
blind. Hello. Hello. See? Anyway. And then another child here we have is with the physical therapy doctor, which is doing incredible work with these children. And what's the name of the child?
He's Raymond Karani.
Gregory. And he's autistic, or
Yes, he's autistic.
okay, he's
Very,
autistic.
Very hyper.
He's very hyper, so he actually goes into a cinema room inside the house with psychedelic lights. They move around and it calms him down apparently. And also they're going to start doing some therapy with horses and dogs. And for this, I urge you to send a little bit of money to these children. PayPal is okay. Now, how many children do we have in this house? 1, 2, 3, 4, 5, 6, 7, 8. And you will accommodate up to 20 children. Yeah, so this is a new establishment. It's only 1 month old, and they are making wonders already. Here is the children, as you can see. I did a panoramic view for you guys. I just had the children sit outside. This is the house that they're actually just rented, and inside is all equipped with physical therapy, movie. Okay, they have lunch here. The food gets donated. This month it got donated by a corporation here in Africa. Next month we don't know. It's always like this in Africa. So we want them to be a little bit stronger financially, by having at least this $700-800 a month in their bank account, so they can pay the rent and they can feed the children and pay the doctors to do their physical therapy. And if needed, we want to give them medicine if needed, and we need to have the medicine in stock. Okay, so for this I will leave you, and I hope you will have some positive comments about this. Okay, so anything to say to everybody around the world?
I would like to thank everybody for cooperation, and we welcome you so much to Furaha Centre.
And to visit anytime they want to come to
Yes.
Meru in Africa. They are most welcome and they can spend as much time as they want with the children. And we will also show them all around Meru and organize a nice, very good safari for them as well. Okay, so goes without saying. This is one of the hyperboy, as you can see, and difficult to control. Okay, thank you.
Make a change.
Okay, asante sana.
Asante sana na karibu Kenya.